Hello, my name is Rihanna, and for this week's discussion, the first question is, what are some ways that miscommunication or communication errors can lead to malpractice in healthcare? I think one of the main reasons that there are miscommunications in healthcare is incorrect information recording. I think that many times information may be misrepresented in the files. Leading to other healthcare providers that are reading the same files not getting accurate information on what is going on, as well as vague instructions. I think that patients may go home with prescriptions that may not have detailed enough information on the prescription, and this can lead to malpractice, so to speak, on the physician, I guess, and the patient themselves. And then I also think that the most common time that this takes place is between the providers and the patient. I think that the poor handoff, so to speak, of information can definitely lead to misunderstandings in what is the correct procedure of care. And then for the next question, should a provider be allowed to practice with a record of malpractice? I definitely think that it depends on the context of whether this is like an ongoing issue or this is just a one-time thing. And even if it is a one-time thing, I definitely think it depends on to what degree. If it caused unfortunately, like somebody passing away, I definitely think that this is not something that we want to see continue, obviously. But if it was a genuine accident and this isn't a reoccurring pattern, I think that there can be some way that we can maybe find some clarity onto how we can prevent this happening again in the future. I think also if they've owned their mistake and have maybe furthered their education to ensure that they took the proper steps to mitigate, like I was saying, this happening again in the future, then I think that that's definitely something that can be done to continue practicing. And then for the last question, should informed consent be used as a shield of legal liability in medical malpractice? I think informed consent should not be used as a shield of legal liability, because I think that there's also some sticky situations that can happen with this, where a provider can say that they informed the patient on what's going on without necessarily fully disclosing all of the different things that could happen. Although this does give some aspects of transparency, I think that there's still room for error. So I think that the shield of legal liability should not be in place for informed consent.